thank you again. Thank you very much for the invitation. And I'm really happy to be talking to everyone today about some of our work and some of the things that we can be doing and helping workers and organizations in terms of cultivating respect, strategies for fostering safe, healthy, and inclusive work cultures. I also had a second title page because some of the recent work we're doing is really talking about, whoops, let me see if this works now. There we go. Talking about cultivating rich work environments. So I liked the cultivator and fields there as an homage to my Manitoba heritage. But we'll talk a little bit about what rich stands for and how that works into psychologically healthy workplaces. And we will go from there. Okay, I'm going to put the chat up just in case but if I miss something, I think there's somebody who will be able to check on that as well. And I see that Carissa has shared with you just some resources, some overview of stuff that I'll be talking about today. And I'll also be sharing more of an overview blog, sort of report on it, blog on it, so you can read that afterwards. So if you have any questions, please feel free to jump in and put those in. If I can stop, or if I see it, I'll answer it, and we'll have a few breaks throughout to allow for questions and some time at the end. So we're really going to, and this looks kind of daunting, I think, in reading it. Don't worry, it's not as bad as it looks. We're really going to be talking about respectful, inclusive, psychologically safe, and psychologically healthy workplaces. And maybe the good news for you is they're really not all that different from each other. So we're really talking about the same thing. We're going to be talking about what IGLOO means in terms of organizational initiatives and interventions, and then most importantly, but what is it that we can do to foster well-being and healthy workplaces? So as caregivers and healthcare professionals, I'm sure you are all familiar with primary, secondary, and tertiary interventions and initiatives. So how does that apply to healthy workplace places and how we develop those? And then we'll look at the builds model, which I find is just a nice little model to get us thinking about what is it that we can do in moving forward, and individually and as an organization for that. And these are the directions for learning that were on, along with the abstract that was submitted, and we'll be going over most of this. I did put a little footnote for the first one. Probably going to spend less time on that, and I'll explain why in a bit, but really talking about the leaders, individual groups, some of the barriers we might be facing, and then what we can actually do about it. So I was just saying, if some people can't make all of this, if they can't stay for their whole lunch, here is basically the take-home messages in one slide. Is really what I want to get across is that creating safe, respectful, inclusive, compassionate, and healthy workplaces is the right thing to do. It's not because it's good for business, or all the other things that it leads to. I think we need to make that leap and jump in and say we are doing it because it's the right thing to do in order of treating people well. So creating these rich workplaces involves a focus on individuals, groups, leaders, and overall organizations. So that's your IGLOO model, and you're thinking about, and we really have to take this broad, holistic approach in order to create those workplaces. So if we focus on only one portion of it, we really miss that big picture. The third point is that these we'll talk about what rich stands for in a bit. Rich workplaces really require joint accountability. Okay, so again, and that is of the individuals. The onus is on the organization as well. We can't. There's no shirking of responsibility here. We all have to jump in and take responsibility for it. Creating these workplaces involves the focus on these primary, secondary, and tertiary, and all are important. But as we see in healthcare too, we'd like to see a shift to more of the primary prevention aspects of it, right? So what is it that we can do to ensure that there aren't problems in the first place, to remove some of those obstacles and create those resources for everybody? Now, the secondary and tertiary are still important, and we're still going to need them there, but how can we shift that to primary? And then finally here is, I think, really integral here is that you can make a difference. And it doesn't matter if you are a frontline healthcare professional or or if you're a CEO, you may have more formal power at your disposal. But I really want you to think about how you can empower yourself. You can make differences in not only your own work environment and healthy workplace, but also in those of others. And I think that's sort of that accountability piece. If we can all jump in, then we can make that work. Okay, so we have a little poll here, and apologies, I may have to use my glasses for this one. I would really like if we can launch this, if we can, oops, we're on the wrong poll here. There we go. If you can just answer 5 short questions here. It's yes, no, and I don't know. First one, like, do you feel respected at work? Have you ever behaved rudely to a colleague? Do you work in a psychologically healthy workplace? Do you feel included and valued at work? And finally, do you feel comfortable or safe bringing up work issues with supervisors, colleagues, or having a differing opinion at work on there? Okay. So we'll give everybody a little bit of time. Okay, we've still got a few, but I think we'll kind of close this off. So get in your responses if you can in the next few seconds. I see a few people still responding. Okay. Okay, we will go here. I will end poll and I'm going to share the results with you. And of course, Carissa, you can jump in to make sure if everybody can see these results. So do you feel respected at work? So this is great. We've got about 74% of you saying that you do. And that's wonderful because I work with a lot of organizations where these results are probably switched, unfortunately, where most of the individuals at work are not feeling respected. Second question is talking about rudeness. Have you ever behaved rudely to a colleague? And we have the majority, so 51% saying no, and 35 saying yes, and then we have a few saying we don't know on that. Okay. And I'm going to share, taking snapshots of those so that we can share later to discuss. Do you work in a psychologically healthy workplace? And again, we've got about a little over 50% saying yes. We've got some people saying, I don't know, and maybe you will have a better answer at the end after we have a chance to talk about some of these things. Again, we have about 65% feeling valued and included at work. But still, I think like a quarter of you saying, no, you don't. So I think that is unfortunate. And again, a good number of you, so the same about as the respect, feel comfortable or safe bringing up the work issues. So that's great. As I say, these are quite promising, some great numbers here. But we're also, again, we want to focus on some of those ones that we're not seeing as positive response there. Is more of most of the time is what and often yes, so some of the comments there in that and that's part of it. Yeah, we're not going to be able to do those feel those way all the time, but if we can feel it most of the time, then I think that's fairly good. Okay, we have a small poll at the end, but what we'll do is as we're going through, we'll kind of talk about some of these data and about how they reflect these different areas. So this was a point one in terms of learning why should we care about worker health, stress, and well-being. And I actually have an entire talk about, and I have data on like return on investments and about productivity and about reduced absenteeism and reduced turnover intentions and increased productivity and all of those indicators of it. And for years, I have been going through and talking to organizations about why they should care about worker health, stress, and well-being. And I don't know whether it's just because I got old and cranky, but at some point recently I just said, no, I'm not doing it anymore because I think this is the answer. We should care about worker health and stress and well-being because it's the right thing to do, period. As healthcare professionals, it's like, what it's kind of similar to say, well, why would you actually care about, the well-being of your clients and your patients? Because that's the job. That's the right thing to do. So I'd like to start changing the narrative in terms of that going and trying to justify why we have to and get organizations just saying it's not that why we should, it's why wouldn't we? Because this is what we do because we're humans and humanity there. So saying that though, if you really do need some data and you'd like some data to share, maybe with some decision makers who are maybe not as enlightened and are really looking for some data of why more investments in time and energy should be put in this way, I do have that. So I don't want to say it's not there. I just want to talk about more important things. And this is sort of a couple of cartoons that go along with that rationale, because I think, if we talk about this, treating your employees with respect is basic human decency. Sometimes we get this reaction, of course, okay, whatever, of course it is. But as soon as we talk about productivity or increase, and then everybody kind of jumps up and takes notice. And again, so I'm trying not to buy into that. And that data, of course, is all made up. It's not 53%. It does increase it, but not by that much. And this is one of my favorite cartoons. This is by Joel Platt, I think from the New Yorker. And it's been modified by me. Apologies to Joel. But it's a climate change summit. But it really struck home. I think this kind of ice really highlights why we need to shift our thinking and get out of spending all of our time and rationale trying to justify why we're doing this. And I really like this and saying, okay, so even what it happens if we just create a healthier workplace and healthier workers for nothing, right? What if this is all a big hoax and we end up with this healthy workplaces and healthy workers? And I think that answers the question. I think that's sufficient, and it should be sufficient for all of us in that. Okay, so now we can shift into what actually are psychologically healthy and what we call these rich workplaces. So the rich stands for respectful, inclusive, compassionate, and healthy workplaces. And this is a diagram I had done for my students. They're off to Ottawa this week doing presentations on some work that we did on developing psychologically healthy workplace measures and surveys. And when we first started out, it's kind of this mishmash of all of these ideas. And I started in this area about 20 years ago, a little bit over 20 years ago, focusing on what it is. And we came up sort of with a first model then that was used worldwide in looking at what a healthy workplace is. And we kind of picked and choose sort of from different areas and what we knew from the stress literature, from the burnout literature. But it was a little bit of a mishmash then. And since that time, I think it's kind of remained. So there's nothing wrong with that. And if you're familiar with like the Canadian standards, it's kind of in the same way. It's kind of just like, okay, let's throw everything in. It does have a little bit of maybe a potential problem if we're just saying anything good is a healthy workplace, but at the same time, it's giving us ideas and areas that we can go, sort of avenues that we can go down in trying to create that. So it's about these positive relationships. It's about being accessible to your workforce. It's being supportive. It's about physical and psychological safety. It's about having diversity, and that can be of ideas, of demographics in your workplace. It's about having autonomy, control, and voice in decisions. And apparently I liked it so much I put that in twice about having an inclusive and a balance, work-life balance, and other balance in there. So This is great. And I think having all these ideas, and we've been playing with them, as I said, over like 20 years, is wonderful. But I do think it could become daunting. So for organizations who are like, okay, great, but what does this mean for us? What does this mean for how we move forward? How can I create this respectful workplace or a healthy workplace, just knowing that these are all the components of it? And I think that's where what we tried to do is we've tried to streamline it a little bit and try to say, okay, what does this mean? So what do you have to do as an organization, as an employer? And this could be, again, frontline worker to top of the organization. What is it that we need to do? Um, okay, so looking at some of these terms, just to kind of put them in a little bit more in perspective here. So first of all, what is psychological safety? So Amy Edmonston actually came up with this term in the 90s, maybe late 90s, and talking about, that it's being safe for interpersonal risk taking. Like, so in terms of how we interact with others. And she recently sort of updated it, which I really, really like the way she talks about it, in that it's a workplace in which people are comfortable expressing and being themselves. They're sharing concerns without fear of retribution, being able to speak up without being humiliated, ignored, or blamed. And a large component of this is there has underlying this is this trust and respect among colleagues and among teams and with upper management as well. So another term you'll see here, we have inclusive leadership. So, and this is based on Randall, and this is what we used when we were doing an iLead program on sort of inclusive leadership, equity, accessibility, and diversity through Women and Gender Equality Canada. And again, it's having that leadership that facilitates the belongingness. It's supporting the individuals as group members, but also as individuals, ensuring justice and equity, utilizing shared decision making and values. So again, that's that autonomy and input, and encouraging diverse contributions to help individuals fully contribute. So we're seeing they're parallel, not identical, but there are a lot of overlap between those two terms. And then we'll also look at respect. And when we see what a respectful workplace is, a lot of times we define respectful workplaces as kind of an absence of a rude or uncivil workplace. And I think that's helpful for us in some ways, because it seems to resonate more with people because they can actually they can identify what the a rude, disrespectful workplace looks like. Um, and here's a little bit of data. I said no data, but I'll throw this in. And this is stuff that I had done with one of my students, Krista Randall. And we did find that the respect subcomponent of healthy workplaces was associated with organizational financial performance. It had very positive employee attitudes, such as commitment to the organization and job satisfaction. And there was also lower withdrawal rates. So, and that included some turnover intentions as well as absenteeism and actually thinking of leaving. So again, it's a very powerful tool and or a powerful construct, and it's one that we see all through the literature and all through organizations. And in fact, and give credit to Aretha here, I had to have her in here somewhere, that really that respect was more important than most anything else. And this is based on a Harvard Business Review study done by Porath of, I think it was like 20, I think I have it here, 20,000 employees around the world. That was in 2015. And what she concludes here is being treated with respect was more important to employees than recognition, appreciation, communicating and inspiring vision, providing useful feedback, or even opportunities for learning, growth, and development. So that trumped everything else in terms of what they were looking for in a job and what they felt was important to them. And the interesting, ironic, and maybe startling thing is she also found is that we have this thing where leaders know that it's so important to show respect and that their employees want it and it's valuable to them, but they struggle to demonstrate it. And I think when we're looking at respectful workplaces and why there's this disconnect, that is one of the critical things that's coming up and why it's happening. And one of the reasons I've seen in here, this came up as a meme, is it's really, there's sort of a perception that this is an individual failing, right? So if your leader is being rude or your colleagues are being rude, it's some type of, they're a weak person, that there's somehow character flaw in them. And I think that's a really dangerous path to go down. Once we start seeing that incivility, rudeness, lack of respect is just it's an individual problem, then I think it doesn't allow us that opportunity to actually make a more respectful workplace. So why do we behave rudely? And if I'm looking at that, I saw that and some people said nope, they haven't been rude to colleagues, and we'll ask another question on that. And others had said, yeah, I have been rude to colleagues at some point. So when we talk about rudeness, when we talk about lack of respect or incivility, we can't tend to use those terms interchangeably. But when we're talking about this incivility, rudeness, it's usually very low level behaviors with what we call an ambiguous intent to harm. So it's somebody does something to you and you're not quite sure if they meant to do it or if it was rude. So if somebody doesn't say good morning to you in the hallway, were they snubbing you, or did they just not see you, or they were lost in their own thoughts? Did they go out to lunch, group went out to lunch without you? Was that because, again, it was an intentional, or they thought you were in a meeting with someone, or they didn't even know you were in the office that day? So it's a combination of how we perceive it and the intent of it. And also when we look at why we behave rudely, it's also very interesting because it all depends on the context. There's so many variables that impact whether we view something as rude or not. Two people could enact in the same behavior to us, and we think one is rude and the other isn't. Typically, if we really trust somebody, we can laugh off some of their behavior. If we don't, then that's when we may take it a little bit more to heart on that. So the one thing that it's not, if you go and look in social media and you look online, you see a lot of images like this under the heading like disrespectful workplaces or increase of incivility. I just want to just emphasize again, this is not incivility, okay? This is getting into aggression. This is that at very high level negative behaviors. Incivility can lead to this, but this certainly is not rudeness or incivility. It's gone beyond that. So I think it's important to remember that when we are looking at reasons behind rude behavior and also how we can create those respectful workplaces. I really liked this. I came across this cartoon and it kind of ties into some of the work that I'll show in the next slide because it's our perceptions, it's our norms, it's the experiences we've held, and it's the trust that we have for those individuals that all impact whether we behave rudely or not, and whether our behaviors are perceived that way. And going back to another one of Porath's, might have been the same one, Porath's study. She cited it was a physician, a surgeon, who had been part of a large study and gotten some feedback in terms of his behavior, and came back where a lot of his work group and team found him incredibly rude, disrespectful, uncivil. And the quote that he came up with, I thought was brilliant and give him credit for some insight. And he kind of said, he'd always behaved towards others the way that he'd been treated. And he always thought that is what you were supposed to do in that role. And that is demonstrating experience, and it's demonstrating knowledge and efficiency in getting things done. And the quote was something like, I never realized that everybody thought I was a jerk until I went through this study. And I think that's really important because a lot of this, when we're creating respectful, that is there's not an intent. The other thing we always talk about in leadership is very few people, let alone leaders, wake up in the morning and say, how can I be a complete and utter jerk at work today? Yet I hear from a lot of people that their leaders are such. So there's just a disconnect between what people think they're doing and how they think they're behaving and how people perceive them. So if we look at this, so why do we behave rudely? So Michael Leiter and myself and a couple of other colleagues have been working on this starting about 10 years ago about why people behave rudely at work. And the reasons that people have been telling us, and we've found sort of relationships to civility and respectful workplaces, is the biggest one is pressure. So, and these are the times, and I think if we all relate, when we're stressed, we are either running around, we have a deadline, the computer broke, there's some kind of emergency on board, and we're maybe a little bit more short or snappy or outright even more blatantly rude to somebody than we would like, ideally. Now, the irony of this is that we can always look at ourselves and say, but I didn't mean it. I know it was an external event. And so, everybody knows that I'm a nice person. It's not me. It was just a situation. And ironically, though, everybody does this for themselves, but when they look at behaviors of others, they see it more of as an internal. So I see myself as, no, I'm a nice person, but I was just had one, I was just stressed at that time. Other people may look at that same behavior and say, that person is rude. And they need to, that's a trait of that individual. The toughness one is sort of like the rationale that we saw here is just that it's called coaching, right? It's called leadership. This is how to be a good leader, or this is what you do to be effective. And that's that kind of, you need to be tough. You need to have you need to be very firm in terms of what you need. So I'm not being rude. I'm just, being a good leader or a good coach or a good colleague or a good nurse or whatever. So again, it's a rationalization that the behavior isn't rude, it's required. Sensitivity is kind of a furthering rationale away from that. And it's my behavior was perfectly acceptable. The other individual is just incredibly sensitive. So they don't have a sense of humor or they have a different view on it. And my behavior was appropriate. And they just need to lighten up a little bit and view it in that way. The reciprocity rationale is a tit for tat, right? They did it to me, so I did it to them. So it's okay because that's what's normally done. And then finally, this is an interesting one because it really illustrates what's appropriate in one not only organization but group may not be appropriate in another. So in terms of workplace norms, and we see this in organizations where they have their own standards of behavior, such that people from other groups or organizations may say, that's not appropriate. But this is where it gets difficult. If everybody kind of feels that it is appropriate in there, it's really hard for us to kind of say it's not. So this is really important. And this is now I'll see if we'll look at this here. If we can do the second little poll, it's just one question here. And uh-oh, it won't launch. Just a second. A poll has been launched in this meeting. There we go. So if we just launch this, if you can just think about, and again, some people said I don't behave rudely. So I think if we could kind of think about at work, why do you, if you kind of, you can only pick, if you can pick one and kind of figure out why, you can do this. Okay, we're still waiting. We'll see if we'll give it a couple more seconds there. See what Yep, people are still responding. Okay. Okay, we'll just do this. We've got about 71% of people. We're just going to end it there. Sorry if you did get a chance. And again, like we see in most of our studies in there, most of the people, it comes down to pressure. And so almost 50% say this. Typically, if I'm perceived as being rude, it's because I'm feeling under pressure and I'm acting on that. I like see yet in a smaller percentage in terms of, and this is what we do see again, is that kind of saying, this is the way I've been brought up in terms of toughness. So about 11% in that. And we have some people, and again, these are all right answers all through here, is saying that, maybe the individuals around are very sensitive to behaviors and they are misconstruing what I say. And about the same amount, about 20% also say it's reciprocity. So it's a give and take back from what I'm getting. And then a smaller numbers kind of saying the behaviors is a workplace norm. And then we do have about 20% saying I don't behave rudely. And this I just want to go back to that we had about 30 how many saying about 51% said they haven't behaved rudely to that. So maybe we're kind of expanding our definition of what rude behavior. Oops, I'm sorry, I forgot to share there. What those what the rude behaviors are. And I always just like to remind again, if we start thinking about all of us are rude, all of us have behaved rudely or perceived as behaving rudely, even if you are the most polite, most respectful person. I can guarantee you at some point somebody has misinterpreted or interpreted your behavior in a way that they thought it was rude. And the best that we can do, again, in creating healthy workplaces and creating respectful workplaces, is increase that communication and that empathy and discussion around, whoops, those are both ended, about around those groups, and to understand that probably it's not an individual characteristic, it's just a human characteristic that way. Okay, so that is just shut off. Way too many things on here. Okay, so just to check in here, just to make sure that I had time to look at any comments that were coming up. Anything, any questions or comments? Again, you can hit in the chat or the Q&A. Okay, good. Oh, you're welcome. Thank you. Okay, so we will just keep on going. So we can actually get into what are we doing about this and how do we view sort of the healthy workplace on a bigger scale. And this is from our Empower a Healthy Partner Workplace Partnership. And I love this tree. It took us ages to get this graphic, and for some reason, I don't know, it just always resonated with me because it really looks like how a healthy workplace can emanate out of all of these areas. And you can't, if you have just one, you're going to have this lopsided tree and it's going to break down. So we have to kind of nourish all of these areas. So when we're looking at this, we have, we can ask in general in terms of how do we foster psychologically healthy workplaces. Here, I've got a question there I'll come back to. How can we foster that as a whole organization? And then, whoops, as a group, how can we maintain those positive interpersonal relationships? So when working together, we can look at the individual level. And with that, it's like, how do we support individual workers, whether it's accessibility, whether it's about developing resilience and skills to cope. And then, of course, last but not least, we're really asking about leaders. I added this into about taking care of themselves because we've done some stuff on leader self-care, but really about what are they doing to support the health and well-being of their workers in the workplace. But we added the self-care because we kind of go with that view, it's like the oxygen mask when flying. They have to make sure that they're healthy before they can take care of other people. I just want to go back to one of the questions here and or the comments. It's hard to know where the balance is when working in a hostile environment. So at some point you have to start at some point you also start behaving in that manner. And that's a really great point because that is we know about that in terms of and it also like a toxic reciprocity, right? And we can talk about that norm. That behavior starts becoming the norm for you. And it's also looking at emotional contagion. So if one in it can and it can happen with one individual in that group, it can kind of change a whole group dynamic and vibe. And it's really disheartening, and also can be quite hard to address. Um, we were brought in once to an organization, a colleague and mine, just as sort of external consultants, just they wanted our opinion on this, where they had this type of hostile environment, very toxic, and really came down, I think, to two or three individuals. And they had changed the departments for them. They had brought the union in. They had been given performance appraisals. They had all of these actions that they did, and they said, we don't know that we can't get them to change their behavior. And we're looking at, other workshops, other development, and so they were brainstorming all of these things. And my colleague, kind of out of the blue too, it was good. Kind of they, and asked what he thought, and he said, fire them. Now, we're occupational health psychologists. We're always looking at how do we support the individual? How do we support that worker? How do we make it better for them? And so I think everybody was a little bit shocked that he would come up with this drastic answer. And he said, you've done everything. You've given them multiple opportunities. You have provided that training. You've provided that support. And they are wrecking everybody else's well-being. They are being toxic across departments. And they have been given those opportunities and have chosen not. The union supports those actions. And I think that's a very extreme case. And of course, it's not the choice that we'd like to take to begin with, but it is, I think, very illustrative how one or two individuals can create chaos in a workplace. So it's really kind of important to kind of put it in perspective in what you're doing. So we have to save the whole tree if it means, a couple bad fruit are trying to rot everybody else in there. Okay, so moving on from that, again, should be nothing new for anybody in this group, and really talking about again, healthy workplace initiatives. So of course we have the primary, and this is where we change the workplace. So we find out what is happening in the workplace that is unhealthy, what is toxic, and how do we go about making that better? That's reducing demands, providing the resources, making it better. And I'm hesitate to say this dealing with healthcare workers because I know this is a challenging issue. And I think a lot of it and a lot of stuff we've done, and when I've talked to the nurses unions and those types of things, we want to go. A lot of times what we do is we end up going to support the individuals, we develop skills, resilience, and how do we do those things, which are very important. But I said, those are band-aid solutions until we actually get at the root of the problem. And the problem, I think in Canada somewhat, is we can't get at the root of it because it's such a politicalized issue. And we don't want to change healthcare because it's costly. We don't want to rethink about how we're doing and make it healthier for employees in that way. So we're always kind of at the mercy of higher ups in doing this, but I don't want to sound too pessimistic and saying there's nothing we can do. There's certainly a lot we can do. And I think that's the first thing, is identifying what are the problems there and what do we have control over, and or what can we advocate for up. As I just alluded to, support the individuals. Again, the secondary is really, and why I said this is still necessary, because even if we had a beautiful, healthy uh, 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 work environment, this rich environment, things are still going to happen, right? Computers are still going to crash, systems are still going to go down, somebody's going to be sick, so you might be short-staffed. Things are going to happen, and we still have to be at our best. So if we have the skills in order to deal with those things ahead of time, then and that resilience when things go wrong, that's going to get us through those tough times. And then, of course, treat the symptoms or heal the wounded, as we like to call the tertiary. Again, and this is a lot in what we do is those are, those are your EAP programs or your EAFP programs, family programs. Those are helping individuals after they're burnt out. Those are return to work policies. Those are workers' comp, and they're important, but we've spent way too much energy on those at the expense of primary. And actually, when I first presented this slide a few years ago, it was just a normal triangle and doing that. And somebody asked me afterwards, they're saying, but are you saying that all the resources are on treat the symptoms because that's the wide base of the triangle? And I said, no, it was just an interesting graphic, but I flipped it. It is an inverted pyramid because I really think that kind of emphasized that's where our time and energy should be put, and how do we make that a better workplace. And we still have to treat symptoms because those are still going to occur. But hopefully, if we deal with it in the proper way, then it's going to take less of our overall time and energy and money. Okay. I'm just checking. Okay. No more questions here. Okay, and just because I found this very mellow, Zen kind of picture, and if you feel you want to share this in the chat, didn't make it a poll just because I knew we were going to be challenged for time. But if you want to think about what thing that you would like changed in your workplace and you feel comfortable sharing, by all means, go either in the question or that, and we'll come back and kind of check on those things. So if you can think of one thing that can be done or that you can do, what would that be that would help create a more respectful, more healthy, and rich work environment? Let me see. Balance, work-life balance, more balanced light, talking about complaints, have some follow-up. Oh, judgment versus accommodations. I like that one. Yes. We love, as human beings, we love to judge. It's very, it's in our genes. Clarity, communication and clarity is one of the big things. And we also give like whole workshops. And how do you communicate in a way that's positive and gets your needs out there met? Check-ins, right? Transparency. The hierarchy of control measures, focus on prevention, elimination, is legally required under most Canadian OHS laws, right? More intensive confidential EAP programs. Okay, excellent. Those are good. Whoops. It's just going in a continuous loop now. There we go. It just wanted to keep the waterfall playing, which is nice. Okay, so if we're talking about these, in our last few minutes and what we're going to do here is, and I'm reading comments, is really going to look at this EGLU, and I'm going to give a couple of examples just quite quickly in terms of what we can do. And I think if we look at we'll go through this. I think, again, first, we'd like to change the environment. And I love this quote from Muna Abdi. It's just saying, instead of asking people to become more resilient, we really need to change the system and that's making them more vulnerable. And again, we need to re-emphasize that point to organizational leaders and governments there. However, and I'm going to give an opposite kind of view on this. But we can say it can also be done at the same time. And this is a Michelle Obama quote. And going about and changing an entire workplace, that's daunting, and we may actually shrink from that. So start with what you can control, and that's you. And that's a very sort of acceptance and commitment therapy, or a very stoic philosopher kind of view, is that what we have most control of is us and our behaviors and what we do. So I really like that, and I don't think these are two totally opposite types of things. I think we can really go about and do both of those at the same time. Another good quote is from Richard Branson of Virgin Air, and who argues clients don't come first, Employees come first. If you take care of your employees, they will take care of your clients. The other thing that I always add on this, because we forget this, is that leaders are employees too. And so we need to start thinking about how we take care of our leaders, because they can be under a huge amount of stress and they are tasked with taking care of everybody else, and we forget about them. So what is it that we can do in the I side of it? So the easy one here, and I say easy, somewhat tongue in cheek, is self-care. So we know that self-care is valuable. We know it's good. We're not always great at it. We did some research with leaders, and they weren't actually really great in it at all. They were really good at supporting their team self-care and encouraging them and giving them resources, but they kind of were less great at doing it themselves because they were spending their resources on others. But if we can do this, and if we can just remind ourselves that this is important and it's integral, then that can be a valuable tool moving forward. Another thing that we think of in terms of the I that we maybe don't often think of, I should say, is that skill development. Now we think about, oh, can I just sort of handle stress better? Can I have better coping skills, resilience? And I think those are important for all of us to have in life. You talked about communication and poor communication. If we had better communication skills, and if our team had better communication skills, that can really create a better environment. If we had conflict management skills, if we know how to bring up those very dicey issues and how to do that, that can work as well. One thing that we don't think, again, job skills. If we have a good match, it's what we call person job fit or person organization fit. The better that fit, the healthier the workplace it is for us, because we are in an environment that works for us. So, and I kind of talk about like the example, actually, healthcare professionals are great. Not everybody can do what you do. It's a very, very stressful job. I would not do well in that environment. And if I did, I'd probably find it a very unhealthy environment, maybe more so because of the match. Not so much even a little bit on the environment, but it's really about how I fit in that. So it's always good to think about what you need, what your values are, and how does that match to your environment. And finally, for the I's, we may not think of this one, is being an ally and advocate. And I think especially when we're at lower levels, and we may feel that we're powerless, like we can't really do anything, we can't change the world. And make it a healthy workplace. The one thing that we can always do is we can be that ally for our colleagues. We can be an advocate for each other. And that has that spiral effect, just like the opposite of when we had those toxic individuals that can create that negative emotional contagion, we can create that positive emotional contagion. So never underestimate the power of being nice, the power of being there for people and advocating and bringing that. So those are small little things that we can do that can have huge impact. In terms of team stuff, and I am cognizant of time, this is a CREW program. This was done in healthcare in Nova Scotia and Ontario. I really liked this project that I was involved in, and it was based on something done with Veterans Affairs down in the States, but it was really on a team level. So it's, instead of being all about you, it's all about your group, you and your group, and that group got to decide, how do we want to be seen? What are our values? How do we want to behave with each other? And they got to set their own guidelines for appropriate, respectful behavior. And we gave them a lot of resources and suggestions and facilitators and support, but it was up to them. And it was really impressive. So over this year time, so the individuals who weren't, the teams and units that weren't in CREW, there was no change in their levels of coworker incivility and other things. We have a whole bunch of other indicators, but however, you can see with the intervention CREW team, there was a significant decrease in just behaviors in uncivil behaviors. Okay, I want to leave a bit of time to answer questions. This inclusive leadership, if we just kind of focus in on this, through this training, and this is through some mentor and coaching training is that we saw significant increases in awareness, in the leaders' awareness of some of these EDI issues, that they were able to become a better ally and mentor, that they were able to encourage this ally and mentor allyship in others. And then there was also an increase in behaviors that supported women. And we have a whole bunch of others. I'm going to just go over this quickly because I want to get to the more value. I think the biggest problem that we have here, so this is a culture model based by Shine in the 90s. And when we think of a healthy workplace and we think about how do we create it, we think about all the surface stuff, or what he called artifacts. So we think about, oh, do we have a walking group? Do we have, a respectful workplace policy? Do we have these things? And it's almost like the artificial trappings. So, it's like your decoration in your house. But what's missing is the underlying values. So we really need to focus on those values, or even the deep down basic assumptions, and looking at how do we create that value. So it has to be that I actually care about the employees. I actually trust them. I respect them. I want to involve them. And if those things aren't changing, we can have all the healthy apples in the cafeteria, and that isn't going to create a healthy work environment. And I use the apple example because I always hear, oh, yes, but we have free apples in the cafeteria, so we're a really healthy workplace. And it's not that you're not because of that, but one apple doesn't make a healthy workplace. So we really need to think about what's driving some of these things in order to create that health there. I'm going to skip over that. I'm going to skip a little bit. If you guys are really into safety thing, I've tried to integrate some of the physical safety language into psychological health and safety, because they talk about hazard identification, hazard assessment, and mitigation. And sometimes that resonates with people. So we can look at those things in terms of significant work-related stressors. What do these psychosocial work stressors look like? We can also think about the mitigation, and again, elimination. That is that higher end primary prevention, all the way down to maybe the secondary and tertiary stuff. We also have to remember about, this isn't done in safety, and I think it does. We have to think about the flip side of that. So it's not only the hazard identification, let's identify those resources. What is it that makes a healthy workplace? What can help me do my job better? What makes me want to go to work? Think about those resources. And we know some of them: having a best friend at work, having good relationships, having a supervisor who respects you. All of those are valuable resources. So how do we get them, assess them, and how do we grow those? So maybe we need more training to develop the leadership and how they can be supportive. Okay, I want to get to this build model, as I say, kind of end off on this. And looking at questions. So BUILD is just a great acronym. As you can see, I love my acronyms and these different things, but it really helps. I find it resonates with organizations because they're just like, or individuals. I don't know what to do. From an organization is really starting about buy-in. So get people talking about this and saying, this is something cool. This is something we can talk about. It doesn't have to cost a lot of money. I love, my colleague had always said, an organization said, we can't afford to develop, healthy workplaces. And he asked them, so, how much does it cost to treat another person with respect? So start with those things, communicate, really engage people. I think the other thing is understand where you're at. And again, this can be an individual level as well, right? So if you want to make some positive changes in how you're interacting with others or your team, you can start there. Thinking about that implementation. The thing that we often forget about is that learn and develop sustainability. How do we kind of go back and check in? Is this working? What do we need to do? How can we change it there? I'm going to leave that so I can have 2 minutes to talk about that. We had those key messages. I hope those have kind of gone in. We've touched on all of those things and really looking at how you can be a part of all this change. I did have some questions. How can you contact me? The link there, if you scan that, if you have your phone, that should take you to the CN Center. So it's the CN Center of Occupational Health Psychology, not to be confused with the Canadian Center of Occupational Health Psychology, which is the large government one. The CN Center is our small community outreach one that's through St. Mary's University. And you can find more about me and project there. You can go to my website or LinkedIn, and I can, if somebody wants some information. So I'm going to look at some of these Q&As. I think we can save those, and I will add some of this. There is that a little bit of that document that I shared before, but I'll put some of those things. More resources about safety and using Hazard ID. There's not a lot out there because I just kind of developed that a few months ago for NAOSH and NAOSH week. So it was more so I just kind of went in and I started linking them. So I can give you what I have and what we've done at that. Feel free to comment me. When a complaint has been lodged, how does management navigate follow-up with the complainant, considering the aggressor's right to privacy versus the need to be complainant to know the action that has been taken? This is a huge thing in organization, and I don't think we have time, sorry. And Marilyn, if you want to send me that note, I can maybe talk it through a little bit more and write there. So I think, yes, my email is there. It's just arla.day@smu.ca, and I'm happy to answer questions. Anything, I think I've answered all of those we've got two things there. Yes. Okay, good. Senior leadership are people. I like that. Yeah, leaders are people too. You're very, very welcome. If employees will be honest with each other and support each other, support more educations in any positions. Yep, exactly. More intensive, and I think we've addressed all of those. You are very welcome. We are 1 minute over. I apologize for that. If you do have some other questions, I'm happy to wait around for a few minutes and answer those for you. And I hope the rest of your day goes very well.